and he had an anterior myocardial infarction, and she came into the hospital and was in despair when she saw the husband, and all of a sudden she herself also developed chest pain. So the question in this case was, who was the patient who had the bigger problem? And I'll show you the images of this patient. Okay, she was 50 years old. This is just some information that I'll give you with respect to her history. And she had hyperthyroidism, which was treated. But she was brought to the ECG, and we looked at the ECG, and we thought that we have to perform an echo. And this is now the echo of this patient. Let me go to the echo. Okay. And again, my question to you, does she have regional wall motion abnormalities or not? I will now, first of all, show you the images of the two-chamber view. Wait, just let me go back one more second. I think I want to show you something else first. Okay, I'll show you this image first. I think this is a bit clearer. Okay, so this is the echo we performed. Again, an image that looks very similar to the one we had before. But I won't tell you what the patient has. Again, I would like to show these images to you first, and you should make your first decision. And remember the things I showed you in the first case and try to apply them to this case as well. Two-chamber view, anterior wall, inferior wall, apical, three-chamber view, look at the wall, compare the segments to each other, look at myocardial thickening, look at the shape of the ventricle as well, and look at the inward motion of the endocardium. Okay, I'll go back to the four-chamber view once again. Okay, look at the wall motion. Okay, we're not focusing too much now on the other things. I think just focus on the left ventricle, because that's probably where the problem is in this patient, I would assume. Okay, so I hope you all saw enough. Let me just give you maybe a parasternal long axis view as well. Aortic valve, mitral valve, left ventricle. This is the septum. What you see here in the parasternal long axis view is the anterior septum. And the region you see here is the posterolateral wall. This would be the basal in the mid. Of course, you cannot see the apical parts because those are not within the image, within the sector. Okay. Okay, so I think you saw enough. Now let me go back to the poll and ask you again what you think of this patient. Okay, so the possibilities are simple anterior myocardial infarction again, myocardial rupture, myocarditis, vasospastic angina, and she's simply in love. Okay, so I can see that half of you have approximately voted. So we're up to 73% now, 75. I think this case is a very interesting case because, as I will show you later, it does make a number of different didactic or educative points. We've got 82%. I think I'll close now. If you want to still vote, you have to vote now because I'm going to close this within a second. Okay. So most of you think it's vasospastic angina. Some think it's anterior myocardial infarction, and 18 of you think that. Let me see. I think I have to close this here. Okay, good. So, and the rest of you think that she's in love. Now, I don't see what this has to do with myocardial infarction or with regional wall motion abnormalities, or do you? Well, let's go back to the echo. This is the 4-chamber view, and what is clear here is that there truly is a wall motion abnormality here in the apex. You can see that the basal segments contract quite normal, but the apex does not contract normal. There's actually an outpouching of the ventricular cavity, almost some form of ballooning of the left ventricle. And this can also be appreciated in a 2-chamber view. We have, oops, wrong direction, too much. We also have here a wall motion abnormality in the anterior part of the myocardium, and also all the way down almost to the mid-inferior wall. And then something else which is stunning in this patient is, if you look at the posterolateral wall, we also have a wall motion abnormality in the posterolateral wall. And again, a very wide apex. So no question, there is regional wall motion abnormalities, and no question that the differential diagnosis I'm thinking of first is anterior infarction. I will show you something now which is very interesting, because there is a way of looking at the regional wall motion abnormality also with a different technique. And this technique is called speckle tracking or strain imaging. And with this technique, what we see is we can see the different segments of the myocardium that contract differently. And interestingly here, we have a very unique distribution of wall motion abnormalities, which does not really look the way an anterior myocardial infarction looks, because we have a normal longitudinal function in these segments here, and in the lateral wall it seems to be worse. And if we go back again to the wall motion abnormalities, we see here, we do realize that it does not really fit to the LAD territory, which would be the apex and the septum, but not so far down into the posterolateral wall, because this part of the myocardium in reality is supplied by the circumflex or the RCA. So something is fishy here. And some of you already know the correct diagnosis, and I've noticed that Irfan and Alan said that this is something else, and they're correct. Basically what this is Takotsubo syndrome. What is Takotsubo syndrome? It's the so-called broken heart syndrome. It's a form of cardiomyopathy that we are now aware of, where patients have very high stress levels and very high levels of catecholamines, and these high levels somehow lead to myocardial dysfunction, which typically is of the form where we see apical ballooning. In other words, where the apex is affected, which not always closely follows the territory of the coronary arteries, especially the LAD. And it is a disease which is usually provoked by very strong emotional stress. And in this case, the emotional stress that provoked the problem was love. She was so in love with the patient that her husband obviously, that she was in such stress that she herself got Takotsubo syndrome. So all of those and that answered she is in love were obviously correct. So don't be fooled. The regional wall motion abnormalities can obviously be something else as well, but still, I'm showing this case, but in reality, be aware that this is a more rare or not so common disorder. So if you see wall motion abnormalities, obviously first think of an LAD occlusion and an anterior myocardial infarction. So this, I think, was a very nice case, which shows you how much emotionality can actually affect the heart, and that there is a close link between other things aside from the bread and butter coronary artery disease and atherosclerosis.